Well, hello everyone, and since we're crossing time zones, I'll do the Australian thing and say good day. I hope it has been a good day for you so far. I'm Randy Longenecker, Professor of Family Medicine and Assistant Dean for Rural and Underserved Programs at Ohio University and Associate Director for Rural Prep. I'm joined today by my co-host, Davis Patterson, who's Research Assistant Professor in the Department of Family Medicine and our Rural Prep Project Director. And finally, our special guest today, Shawnda Schroeder from North Dakota. So we truly do span the nation in today's event, and we thank you for participating. After an introduction, our speaker will present, and then Davis and I will be leading you all in some interaction. If you have questions at any time during the webinar, again, please feel free to enter them in the chat box and we'll address those in the discussion time. Unless Shawnda sees something that she wants to respond to in the moment. Davis will initiate the discussion period, and then I will facilitate that discussion with our presenter around the questions that you've entered. Please, again, select all panelists and attendees to direct your question to all of us. This is a professional development webinar courtesy of Rural Prep. Rural Prep is an acronym for the Collaborative for Rural Primary Care Research, Education, and Practice as part of HRSA's Bureau of Health Workforce initiative to promote a community of practice in evidence-based training in primary care education. Our mission is to improve and sustain rural health, and we do this in a variety of ways. These webinars are intended to strengthen our community of practice around these goals. These professional development webinars are intended for rural health professions, educators, and researchers, whether you are faculty, residents, students. We're all in this together and improving the field of rural medical education. And generally, these webinars occur on the fourth Thursday of each of the months named there. This month, we had to move it a couple weeks early to accommodate schedules. Here are the objectives of our presentation today, and you've probably already seen these. Our final objective, as always, is to invite you to join our community of practice in other ways through Rural Prep. Well, it's my pleasure today to introduce our speaker, Shawnda Schroeder from North Dakota, and while she's sharing her screen with me, I'll just say that I've gotten to know Shawnda primarily through interactions at the National Rural Health Association and through her role as principal investigator for the Rural Health Research Gateway. So we're really pleased to have her with us today, and I'll leave it to her to tell us of all the other roles that she plays.
Great, thank you, Dr. Longenecker. Thank you for everyone that invited me to be a part of the session today. As Randy shared, I am a research associate professor, but one of the projects I lead happens to be the Rural Health Research Gateway. And the Rural Health Research Gateway is really focused on disseminating the research findings of our rural health research centers. So just briefly, so you know why I'm even here talking to you all today about disseminating research and writing journal articles. The Rural Health Research Gateway provides access to publications and projects that are funded through the Federal Office of Rural Health Policy. So if you are doing research in rural health, I would encourage you that in the very onset of your study, you visit Gateway and try to see what research has already been done, review some of the findings, look at the methods, and look at the publications that they've written and shared with various audiences. The audiences include students, policymakers, other researchers, providers, and other rural health professional organizations. So it really does attempt to reach a diverse group. Specifically, some of the things on the website are its connections to the policies and research centers themselves. You can gain access to both reports and journal publications, fact sheets, policy briefs, other research projects, email alerts, webinars, and more. And one of the things I'm going to focus on today is talking a little bit about the dissemination toolkit that we have developed, because the purpose of that toolkit is to do similar to what I'm doing today, and that's to help researchers think of different ways to share their work, journal publications included. So for those of you who maybe aren't familiar, this is just a very basic visual of the knowledge translation process. You develop your research question, you design and plan your study, you do your collection, and then we come to step 4. And that's the focus of the toolkit that we've developed. But step 4 is tailoring and telling others about your research. This is extremely important, and I'm a strong proponent of saying that you should be thinking about step number 4 when you're doing step number 1. So when you're developing that research question, you should start thinking about who you want to tell the results to. Who is your audience, and how do you hope to tell them? Because if you can, ideally, it would be great to bring them in to your research study at the very beginning and ask them, what are you hoping to learn? And once we've figured that out, how do you want us to share that back with you? This is the toolkit that I've mentioned. We developed this toolkit specifically for rural health researchers. The idea was that nobody can be great at everything. And so we really wanted to help our researchers figure out different ways to share their work. So if you're really great at journal publication, but you're not so great at fact sheets or infographics, you can come to this toolkit and look at the tips and guides for how to do that form of dissemination. Conversely, if you're really great at infographics, but you don't have as much experience in academic publication, you can come to this toolkit and get that same information. We also know that none of us have a lot of time to look at all of the ways to write something. And so this toolkit is made to have 1 page of tips, tricks, and guides, and then a 1-page example. It's really it condenses all of the information that is out there about how to do each of these products and gives you what you need for reaching your audience around rural health. It's also interactive, so trying to save trees and not print a ton of copies of the product itself. You can access the toolkit online and you can walk through each of those steps yourself. So if you're looking to write a policy brief, you click policy brief, it'll give you all of the tips and guides. And then on the right-hand side, you'll have examples and images that you can look at of effective policy briefs that have been done specifically in the world of rural health. So today I'm not here just to talk to you about Gateway though, and what you can do with Gateway, because there's so much more I could say. But what I'm really here to talk to you today about is how to disseminate your work, how to disseminate your research with a focus on journal publication. So just to lead in, some of the general rules for disseminating rural health research is that ideally when you begin your work, you're going to engage those end users at the very beginning. This really is beneficial for a lot of reasons. First of all, it helps you guide your research so you know that what you're doing will be meaningful for the audiences you're trying to impact. But secondly, you can gain insight that you might not have had prior, and you leave them wanting more. So if you reach out to an audience and you say, I'm studying this work, how would you like to see the results when it's done, and what kind of questions do you have? You now have that entire audience waiting for that product. It means you already have an audience that's going to consume your product when it's done, which is great. That's not always feasible, and sometimes it's a little too late. So if you're all sitting there thinking, well, I've already done my study and I just want to share the results and I can't go back in time, what do I do now? At the very least, you can engage them when doing the product itself. So if you have finished the study and you have pages upon pages upon pages of data, and you want to figure out what to report and to whom, you can engage your audience then and ask them, how best do you consume this information? How do you want this to be shared? And what do you want to know? So in that same regard, you could present these findings in more than one way. If you asked other peers and academics, they're probably going to say, well, I want to see it in a journal publication so that I know that it's been well vetted and I can test the methods myself. But if you ask your rural community, how do you want to gain information and how do you want to read these results? they're not going to care about your p-values and they're not going to care about your methodology, but they want to see what the results are. They may just want a fact sheet or a policy brief if they want some implications. If you're looking with public health, for an example, they may want just a simple infographic they can share with their rural communities. And even though in the journal publication process, you can't, you run into issues of self-plagiarism and copyright. You can't have a bunch of infographics and fact sheets floating out in the world and then write a journal publication that presents nothing new. However, you can very easily, at the onset of beginning your publication process, think about what results should go where. A good example that I have of this is a study that we did on stigma around mental illness. We involved all of our rural and urban communities. We did this with our chambers of commerce, and we asked our chambers of commerce on day one, when this is all done, how do you want to share the results? And they said they wanted a simple policy brief that just gave a couple of visuals and basically said, there is stigma or there is not stigma. And if there is stigma, who's holding stigma to those with mental illness? At the end of the day, when we had our results, we gave them just a couple of charts, a couple of figures. It was about 4 pages, and that was the policy brief. But that didn't mean we couldn't still publish. Now, in our journal publication, we couldn't share what we had just studied. We couldn't share what we sent out to the chambers because it's already publicly available. But what we could do was now look at the rural and urban disparities in stigma, look at the variation in gender. We could do complex weighting, and that's what we did. We applied different statistical models to try to figure out which demographics are maybe higher risk for increased stigma, and really, I mean, read the journal article when it comes out, but a lot of good information. But it was really an opportunity for us to say, we have different audiences, let's make sure we meet each of their needs. Regardless of the product type you choose, the 3 most important sections are the title, the abstract, and the introduction. Some journal publication tips now. In the journal publication process, what's really important is to narrow your research to a key finding and determine the number and type of publications. This is basically what I said on that last slide about thinking about multiple modes of sharing your results, because you really don't want to try to capture everything in one publication. Even if you don't plan to write a journal publication and you want to do policy briefs or fact sheets, think about breaking them up by topic. For example, we had data looking at oral health among 3rd graders in our state. It was a lot of data, a lot of information, and it was great information, but it was too much to put into one product. So what we did is we created a fact sheet that looked at just the racial breakdown. We created another that looked at just the rural and urban comparison. We did another that just looked at income level of the individuals accessing oral health care. And they were very simple snapshots, fact sheets. So they could say, I'm just interested in race. I'm just interested in economics. I'm just interested in geography. And they received that fact sheet. But then we were also able to do multiple journal publications that were looking at the influence of race on oral health status, controlling for other variables. So we were able to use complex models, statistical models, and report all of those things that our community said they didn't want, specifically methods and p-values. So consider that when you're looking at your journal publication. Consider multiple journals, consider multiple journal types, and develop and sign authorship agreements. This is probably one of the best tips I can give to anyone who's really new to the journal publication process. What you can do during this authorship agreement is sit and talk with one another and determine roles. This doesn't have to be ironclad. You don't actually have to get signatures. It's not an actual contract, but it can really help in identifying your role, knowing the timelines that you all agree to, and it can really help, kind of get rid of any negative feelings somebody might have at the end of the day if they come back and say, why am I 3rd author? I thought that I was 2nd author based on my contribution. And as much as academics, we'd like to say we've never had to get into that situation, I think we've all ended up in it at least one time or another. So this is an authorship agreement form that we use in our office. It's not pretty, it's not meant to be pretty, it's not outward facing, it's just something that we work on together on the first day we start talking about a journal publication. It's going to be different based off of your team and the number of authors that you have. but this is just an example of one that we used. We list the authorship, we all agree to it in that first initial meeting, and then as a team, we identify all of the responsibilities that need to fall on the shoulders of the first author, the second author, and so forth. In this particular example, we had identified that the first author would do a bulk of the writing and pull everything together in the end and do the submission process. Our second author was really responsible for a lot of the methods and presenting the results. When we come down to our fourth author, this individual was responsible for helping to write the implications and then doing the final review. These are not the responsibilities that need to be the same for an authorship agreement you develop, but this is an example of ensuring that that first author really earns that first author place on your journal publication, and to ensure that whomever is the fourth author or your last author is still having an opportunity to contribute to the document. That said, we have definitely had times when we've had an authorship agreement like this in place, and we have adjusted it partway through. All of a sudden, some of the bullets for author 2 were falling onto the shoulders of author 3. And then as colleagues, we could sit down and say, you know what, Cole is now taking on more responsibility because Colette had to submit a grant application. Are we comfortable with switching authorship? And when you have this document in front of you and you're able to actually itemize the roles and responsibilities, it's very easy as a group to decide, absolutely, let's shift the authorship. Also, all of the authors at the end of the day need to agree on the final manuscript. Never submit a manuscript for review unless every member of your publication team have reviewed it and given their final comments. Selecting a journal. This is a question I even get from colleagues still today. They'll send me their actual article they've already written before they've even selected the journal, and they'll say, what journal do you think this is a good fit for? That's not the way I would recommend writing, because you've most likely wasted a lot of time writing something that you're now going to have to adjust to meet the specifications of a journal. So in selecting a journal, choose the journal before you begin to write. You don't need to choose the journal before you do the research study or before you know what your results are, but when you're ready to start publishing, pick the journal before you start writing and putting a lot of time into the whole format. There are a couple of ways that I encourage individuals to look for the best fit for their publication. One is the research methodology. When you are trying to find a journal that's a good fit for your article, try searching similar methodologies and trying to figure out which journals have published that form of research prior. For an example, if I've done qualitative research, there are quite a few journals who very rarely, if at all, will ever publish qualitative research. They might even specifically state it in their mission statement. Conversely, you might find journals that will only publish clinical trials, or you'll find a journal that says, we won't publish clinical trials, we're only looking at social determinants of health, or some other example. You can have journals that are focused solely and entirely on educating educating future physicians. And it's going to be really focused on the education method and what are the outcomes of teaching students in that environment. And so you really need to try to figure out, is the methodology I used for my study a good fit for this journal? Another important consideration would be the audience. And I am on the editorial board for the Journal of Rural Health. And so I should probably say that if you're doing an article in rural or rural health, you should submit to the Journal of Rural Health. However, as a rural health advocate myself, I kind of take a different position, and I feel like there are so many journals that look at extremely important issues in health, healthcare access, that do not have a strong rural focus, and those are the audiences I want to reach with my work. If I'm doing research on diabetes in rural communities, I could definitely submit that to the Journal of Rural Health, because there you have a very clear relationship. It's rural communities, it's rural health, and that's what I studied. However, I might want to reach audiences that work specifically in diabetic education or around nutrition, because I want them to recognize why rural residents are different, or why there might be more disparities, or how can we bring around health equity around diabetes management in rural communities. And so really think critically about the audience that you're hoping to reach. Is it clinicians? Is it educators? Are you trying to reach other researchers? And put forward some thought as you decide on the journal, and always know that you have options to publish in, to publish in another journal at a later time if the one you initially shoot for doesn't accept. And I say that because if you're writing something specifically on rural, I've had a few journals who have shot back and just said, you know, the topic area is great. However, we're more interested in the larger, the macro level, and not the narrow focus of rural because it's such a small proportion of the United States. Twice I've received that critique. I strongly disagree with that critique. However, at that point, that's when I can then say, well, then I'm going to publish this in a journal that focuses on rural, focuses on community health or public health. And so there's nothing wrong with trying to reach those audiences that don't always open up their minds to rural. And if they won't publish your work, trying another outlet. Another way to figure out which journal you should publish in is to look at the literature. You're going to have to write a literature review. So when you've compiled all of these existing journal articles that you're going to be pulling from, look at where they were published. You might be surprised that all of a sudden you have 6 different articles that you were really enthralled with that you are citing and utilizing, and all of them were published in the exact same journal. That's probably a good place to start. And once you've gotten a huge list of journals that you think might be a good fit, then you can go to each of those pages, their websites, and you can review their impact factor, their mission, their aim, their scope, and their authorship guide, and see if it is a good fit for the study that you've done. For those of you who aren't maybe as familiar with impact factor determines, it's sort of the scoring rubric of journals. The higher the impact factor, theoretically, the larger the reach of that journal and the better. I don't always agree with impact factor because, for an example, the Journal of Rural Health has a very specific audience that we are trying to reach. So while we want our work to have a significant impact, we also recognize that our pool of people that we're trying to reach, those interested in rural health, might be smaller. So it may not have as high of an impact factor. So me as an individual, I will strongly promote thinking more critically about the audience and caring more about making sure your work reaches the people who can do something with the results of your study, as opposed to getting too hung up on impact factor. Then again, some of you may be faculty and you may have a requirement in your contract that says you have to have a journal of impact factor 4 or higher. So I just wanted to at least have the bullet in the slides. This is a journal grid that we have used in some of our writing teams. This is not required, but it can be very helpful if you have a team of 4 or 5 working on a publication together and you want to sort of share the load of trying to figure out which journal you should publish in. What we do is we create this table. You don't have to have the same columns that I've illustrated here, but these are the columns we use the most often. The things that we want to think about as a team when picking our journal is the impact factor, how frequently they publish. Some journals are twice a year, some journals are every month. We also like to see if there is a submission to decision time. So from the point at which we submit our article, how long will we wait before we get a decision? It can be as short as 4 weeks, it can be as long as 6 months. So really consider that when you're submitting a publication as well. Then we have the audience again and the aim. And then things that we've also identified are similar articles. So for instance, in my stigma example from earlier, once we had identified different journal options, I would bullet list articles that had been done on stigma, that had looked at mental illness or mental health or behavioral health, different keywords, and I listed them there so we can see, get an idea of what are our chances of being published. Did we contribute something new? And are they interested in stigma and mental health at all? Once we have all of these listed, we basically send the table out again and just ask each of the authors, the co-authors, to identify the rank of the journals we've listed. And we try to figure out where we have the most agreement. The first author gets to break any ties, and then we just begin to publish, write, and submit. And we now, fortunately, if we get a rejection letter, we have this list of other journals we can try submitting to that we had already identified as a possible good fit. Now, when actually writing the article, you need to become familiar with the author guide for that selected journal. Most journals are going to follow a very similar format of an introduction, methods, results, discussion, conclusion, but there's going to be very clear specifics depending on the journal. Once you have that journal specifics, it's helpful to create an outline and put the headers in from what that journal wants for headers. Look at other articles that have been published by that journal and review the headers. Look at the word limit for each of those sections and familiarize yourself with the process for submission. A lot of them will have the requirements in the authorship guide, but then when you get into the electronic submission, they'll have a couple of other things that they need from you that you might not have been prepared for, and that can really slow down the submission process if you hadn't realized you needed, for an example, a conflict of interest form signed by every author. So go in and get familiar with the online submission process. And then with your team, determine which sections of the article do need to be written first so that you can set clear deadlines for your team. As an example, in a recent article that we wrote, we knew that we couldn't do the discussion section without the results. That's pretty common. So the individual responsible for the results was first on deck. They had a date they had to be done by. And then, the individual then writing the discussion, which happened to be me, would then step in, and I had a certain date that I had to have my discussion done by. And then that discussion went back to the individual who had initially written the lit review, who then would make sure that the literature supported the conclusions that we had drawn at the end. So it really is a domino effect of writing. And one faculty member or one co-author can really change the process if they fall behind. And so it's malleable, it's a moving target, but timelines can be really beneficial. These are just a couple of screenshots for those of you who may be brand new to the journal publication process. This is where you can usually find your authorship instructions. You would choose author instructions here or the submit a manuscript, and it would walk you through all of the guides and requirements. Here's another example from the Journal of Rural Health. Here, the button that you would select is contribute, and then we have author guidelines, and it'll open a full document talking you through all of the stages of submission. This is another example. This is an interactive instruction for authors page from JAMA. It walks you through format, what to submit, when, and how to move through the process. This is now just another example of how the requirements will vary depending on if it's an original research question or if it's a clinical trial. You get different word limits, you get different numbers of tables, you have different ways of providing key points, you have different checklists that you have to follow, and I'm sure by now you're feeling extremely overwhelmed and questioning if you even want to publish. But it really isn't as overwhelming as you maybe think. And once you know what you're writing, you can just narrow in on your journal article type and your journal that you're interested in and really create a focused outline. So important considerations in writing that publication, as I've mentioned, the title, the abstract, and the introduction are the most influential. And so I've provided a URL here for you to go and get additional tips on writing a good title and additional tips on writing an abstract. Your cover letter should specifically mention why this article is a good fit for that journal. It is always beneficial to tie it into the aim or the scope of that journal. And they may say the cover letter is optional. I never take it as optional. I always write a cover letter so that I can truly make the case for why this information is in line with that journal and important for their audience. And then prepare to wait and wait and wait and wait and wait. It can be a very long process, which is why we encourage you to also write policy briefs and fact sheets and other forms of information dissemination, because otherwise you may be sitting on sharing the results of your work upward to a year before the journal has published and released your work. Rejection is very common. Look at the journal's acceptance rate. They can range anywhere between 2% and 18%, and there's generally not, very rarely will you have journals where it's an 80% acceptance rate. So recognize that before you submit. Try not to take rejection too personally. And if given the opportunity to resubmit, always, almost always accept that opportunity to resubmit. These are the 4 decisions you typically get when submitting a journal. You'll be accepted, rejected, or you'll be asked to resubmit with minor revisions or resubmit with major revisions. What's considered minor and major is relatively subjective. I have personally received minor revisions that were more overwhelming than major revisions that I've received from other journals. Major revisions are generally focused on changing something in the methods, which will then impact the results or the presentation of results, which then might change your conclusion. So they really are a little bit more significant. Minor revisions generally come along the lines of, can you provide more information about XYZ? Can you update the literature? Can you use more current research? Something along those lines. In the revision process, it's usually the responsibility of the lead author, but they know who wrote each section. So if the edits are primarily in the lit review, you can call on the author that did the literature review to help make the revisions. Meet with your team and talk about them. Make a revision grid for the journal. I like to do just a 2-column grid where I list all of the critiques, and then in the next column, I list all of the ways that I address those critiques. Journals will most likely want to track change document and a final document. So that is something to keep in mind as you're making the changes. Track those changes and make sure you address every comment. You don't have to make every change that is recommended, but if you're not going to make a change, you need to write it into a comment box why you're not making that change, or explain why you don't have access to that data. Many times I've received a critique where they said, it would have been great if you could have asked XYZ. And we didn't ask XYZ because we didn't have the data. And so those are pretty easy to address, but if I just ignore them, it looks like I didn't care about the comment. So always address them, even if you just say, we can't do this at this time, but that's a great question. Maybe when we have data, we can answer. Every author needs to approve that new version too. So even if you as the lead author see that the edits are small, you can make them very quickly and you can resubmit. Make sure every member of your team has a chance to review those changes as well. And then finally, just a couple of last tips that don't really fit under any category, but once you're published, promote through social media channels, share it among your colleagues. It's a long process to get published. It can be discouraging, but once you've got that manuscript, make sure you promote that and share it with as many people as you can. Consider what other products you can now develop. Maybe you have another publication that you can write with additional data from that study. Maybe you can be doing fact sheets and policy briefs while waiting for that publication. And consider having one research team working on multiple publications at a time. Maybe you have 3 publications that are in process. You're the first author on one, the last author on the other, and third author on the third, so that you don't have all the responsibility of each, but they can all be flowing at different stages so that at any given time you have a publication you're working on while it's in the hands of another teammate. And think outside the box about what is publishable. I don't think I really need to drive that point home as much with this audience because you know the work that you're doing and what's publishable. But I really like to use that point with National Organization of State Offices of Rural Health. So many of them are doing great community work, great rural health education, and they don't see how that's a manuscript. But I think I've at least won over at least one of my colleagues who hosts scrubs camps where they bring in youth and teach them about all of the different health occupations, youth from rural communities. And then they do an evaluation about what the students thought of the event. That's publishable. You have to think about which journal, but it's definitely publishable. And we want to make sure that individuals understand all of the great work we're doing in rural workforce, in rural education, and rural health. And then don't forget your audience. Keep them in mind at every stage of your research. This is the contact information and how you can connect with us at the Rural Health Research Gateway. We have a Facebook page, we have a Twitter page, we also have an email where you can email the Rural Health Research Gateway directly, but you can also just reach out to me. We have new research being shared all of the time. And I'd also encourage you to share your Twitter handles when you publish work and use the Twitter handles of the journals that publish your work. Follow them on Twitter. If you have a journal that you work with pretty regularly, follow them and watch what they're up to and see what kind of work they're publishing, because it really does give you an opportunity to see what matters in their work. This is just a link to the Rural Health Research Gateway, and I will stop now and see if there are questions.
Thank you very much, Shawnda, for an outstanding presentation. And we've had several questions asking about that authorship form. Is that something that's available for sharing?
Absolutely. I'll send it to you just in the Word document in the format that we use it, and feel free to share and use it as widely as you can.
All righty. You'll disseminate your document. Well, Davis, you want to start us with some questions, and then I'll pay attention to the chat box and we'll take it from there.
Yeah, and thank you, Shawnda. That really was great. And in fact, you already answered a couple of the questions that I had planned to ask you, so I had to come up with some other ones. And I'm actually going to start with that one that was just put in the chat box, because that was the first thing I wanted to ask, which is about predatory journals, open access journals. I know that at this stage in my career, I think almost daily I get invitations to submit to journals that are somewhat suspicious. So how does one make sure that they're actually going to be submitting to a real journal that's quality? What about submission fees? And just your thoughts about that, how to best weed out the real deal versus the predatory journals.
Absolutely. So I would agree that one of the greatest red flags are journals that email you directly and say, we would like you to submit a journal publication on the clinical impact for oncology, and you don't do work in that at all. So that would be my first red flag, is when I get articles saying, you're a great fit for this clinical journal, and I am a PhD with very little clinical background. I realize quickly that that's not the journal I should be submitting to. But other than that, when you are doing an open search and trying to find the best journal, the thing I would encourage you to do is to look at their impact factor. Usually they only report an impact factor if they are assigned an impact factor, and they'll only get that if they have gone through a vetting process. Explore online libraries that are well trusted and vetted, like EBSCOhost or PubMed, and see if they're using that journal. And if they're not, then that's maybe a red flag. This is very much like information you find on social media. Search it and vet it a little bit, but then look at what they've published previously. And if you're still really on the fence about whether or not it is a predatory journal, just looking for you to have to pay a fee and publish your work, or if it is reputable, I would actually look at the authors that have been published and then try to search that author and find other work that they've published and see if it's been in reputable journals or not. And maybe do a little bit of work on the individuals being published. Unfortunately, you used to be able to tell very quickly if there was a fee, it was probably not a good journal. They were probably trying to scam you and you shouldn't be publishing with them. But that's changed. The world of publication has changed dramatically, and now there are definitely publications and journals that are very reputable that do require a fee. And because of that, you know, a lot of researchers who are grant funded are working with their grant agencies to say, here's a list of journals I know are reputable that I want to publish in, but they have a fee. Can I write that into my grant? Can my grant cover the fees for publication? Because that unfortunately isn't an easy way to know any longer. And in terms of open access is a great thing. It's expensive, and that's something where you might have to be asking your funder to pay for open access. If it's a journal that is all open access and not because of a fee, then you might want to do a little bit of looking into the journal to make sure it is a reputable journal, because at some point it may just be a predatory journal. And what that means is a journal that isn't real in a sense. I mean, it exists, but it's not a reputable journal, and it's not where your peers are going to get their information. There used to be, just as a note, there used to be sort of like this black web that identified all of the predatory journals to help researchers, but that was quickly taken down. And if it would ever go up into existence again, I would love it, but it only exists now outdated and on the dark web.
Maybe worried about slander or something like that. I don't know. That's yeah. Okay, that's great. I had a question going back to the decision of who authorship order. And this is something that, you know, so I'm a sociologist, and so I came from not a health discipline, and now, you know, all my work is healthcare related. And there are different ideas about author position in different disciplines. And so, you know, being in the first position versus the last position, I've been told that you know, first and last are the most prominent positions, and second position is good. If you're somewhere in a large team and you're somewhere further down than second and you're not last, then, you know, it's a publication, but it's not like a gold star on your CV. But, you know, I don't know. I think it depends on the institution too. So I'm just wondering if you have any thoughts for people that are approaching this, like what order of authorship, what authorship position should I be aiming for? What's meaningful?
Yeah.
If they're all meaningful, but you know, which ones are the ones that carry the heavy weight?
Mm-hmm. No, I think that's a good question. Clearly, first author is sort of your greatest gold star that you want. It takes the most responsibility and it does the most work. However, the kind of a rule of thumb is to try not to get beyond 5 authors. Beyond 5 authors, it sort of loses its impact, which can be hard when you have like a program that you're implementing and you had a lot of people that were integral parts of each stage. Another important consideration that I thought of as you asked that question is whether or not somebody in a quantitative study, if they ran the data, are they an author or are they a contributor? And that's something that in our team, we identify day one when we do that contract. And so we look at the journal because they'll sometimes have rules about that and who can be an author and who can't. But then we'll also talk as a team to say, okay, sometimes it's a student and student A is going to just apply the models that we've already developed to a data set that we've already cleaned. And they're just basically going to export and build the tables. That becomes an acknowledgement. Now said student is actually going to develop and test a few of the models and apply them and kind of do a trial and error. And that student's also going to then help us write the methods section to describe what they did. Now that's an authorship. And so I think it really is helpful if at the first moment you come together as a team, you talk about who is an author and who isn't. And then in terms of your own placement, yes, the things that people see the most readily is the first author and the last author. And if you become author 6, 7, and 8 in a 9 authorship team, it's not as influential. You clearly you contributed, you were a team member, but it's not going to have the same weight.
Great. Well, thank you. And I'll just add that I think, you know, for people that aren't aware, that being the last author often could indicate that you actually are the PI on a large grant with a large team. And so that's a prestigious position to be in, but not always. So it sort of depends. So I think I'll turn it over to Randy to see if he has any questions or has things that he's seen in the chat box that he wants to ask.
You bet. Well, we've had a couple questions about the posting of this presentation and recording of the webinar, and this will be posted to the ruralprep.org website within the next week or two. So we hope to have those up fairly quickly. Do you use ORCID, ORCID?
I do. I did. I have a sign-in. I have a password, but that's about where it stops. Unfortunately, I think ORCID is a great idea. It's a great way of tracking your publications, their reach, and their impact. However, since the onset of ORCID, they have developed 400 other platforms of tracking your publications and your reach. And my university alone has 3 that I have to submit to every time I have a publication. 1 through my School of Medicine, 1 through my university, and then 1 through a statewide library for our statewide university system. If I can remember to do those 3, I'm happy. And so I don't think there's anything wrong with using ORCID. Would I recommend it during publishing? Yes and no. I think what matters more is what does your university use to track your reach? What is your department requiring, and how do you best identify what libraries do you have in your access to look at journal publications?
Excellent. We did have a couple questions about interactions with the editorial office. I'm going to take them a little out of sequence and just say, what is the best way to connect with journals when starting my research to have the conversations regarding what they or my potential audience are interested in?
It's a good question. So if you've identified maybe 3 or 4 journals that are of real interest to you, but you're still on the fence as to whether or not they would publish your work, they usually have somebody you can contact, a member of the editorial team or the editor directly. and you can reach out to them and give them a brief synopsis of your work. Say, this is the title, this is why we think it's important and what we think its reach would be to your journal. Don't give them all of your results, but give them just enough to make a decision and keep it brief. And then just say, do you feel this is a good fit for your journal? But recognize that even if they say yes, that doesn't mean your chance of publication is any better than anybody else because they've not seen your actual article. But it does let you know if you're on track. It's very similar to how you might reach out to a granting agency and float an idea by them and say, this is what I'm thinking of a grant idea for this particular proposal. Is this fundable or not? It doesn't mean you'll get funded, but they'll at least say, you know, actually, we're not doing any publications on oral health right now, and it's not an area we're interested in. And then you know, and you've saved time in writing your journal on that topic. The one thing I would warn about is that in doing that outreach, you're going to add time to the publication process. So if this is something you want to do and do that outreach, do it early, even before you have all of your results, even if you just have your research questions, because they might not, they may not respond timely. It may take a couple of weeks to get a full answer from the journal.
Well, the second question may be more difficult, and Davis, feel free to respond to this as well. Are there ever instances where you should contact the editor of a journal if you feel the decision to reject was incorrect?
I would say no, but this I think is more my personal, this isn't a rule of thumb, and maybe Davis will have a different perspective, or even Randy or someone else, but I would say no. Very rarely will you get them to overturn the decision. The acceptance rates at some journals really are 4%. And so you really shouldn't take it personally. It may not be that your article isn't good. It might actually be a very good article. But if the journal is getting 1,000 articles submitted every month or two, and their journal itself could only house 6 articles, it may be that your topic's just been done the last couple of publications, and it's just not a good fit right now. So even when the comments may be wrong, they might say, well, you didn't use this particular test, and you did. I still wouldn't fight a rejection. I think you would be better off spending your time identifying another journal and taking the comments that were valuable from that edit and that review to incorporate into your next publication. I've had articles that we've submitted 6 times before it was published, and just know that there's nothing wrong with that, and eventually you'll find your audience in your home, and then that audience will appreciate the work you've done.
And I'll just add that I agree with Shawnda. I think, ultimately it's editor's discretion. Unless you think they clearly misunderstood something so first of all, I'd say when you submit, you might get a rejection immediately, and there may not be any explanation of why. And that's actually nice because it frees you up to go to the next journal, and you don't have to do any more work. On the other hand, you don't get feedback. But if you've been in a resubmission process and you've received feedback and you've done your best to address it, and then they still reject it, unless they've said something that indicates that they don't understand, or that there's some factual error in their rejection decision or something. I can't even think of an example of this. I agree with Shawnda. Respect the editor's decision and take the feedback and move on.
Mm-hmm.
I think the only exception might be if there's a lack of clarity in the feedback you got. In other words, if they're inviting you to resubmit, but it's not very clear what it is that to you as the author, it may be worth contacting the editorial office. But I agree, it's not your place to protest the rejection. Good. Davis, are you seeing any other questions there you want to go to next? We have about 5 minutes yet.
I actually want to ask a question, just as having been a reviewer of many articles, and it's been a really great learning process for me. Are there sort of common pitfalls or things that you see, and you as being on the editorial board as well, sort of easy things for people to avoid when they submit an article? What's your top checklist of pitfalls to avoid in a submission? Because I'm surprised at what I see sometimes. And so you've probably seen a lot more than I have.
Yes. The one thing I would say that I would really focus on is knowing that journal and that audience and who plans to read it. So for the Journal of Rural Health specifically, we get quite a few articles where when reviewing it, I'm floored at what is defined as rural. And so maybe you're not a good fit for our journal if you can't clearly identify what is and is not a rural community. That said, if you're looking at something where you're comparing race, make sure you know what you're talking about. Use person-first language. I know that that can be, especially in health journals, and if clinicians are writing, I notice that I can usually tell that a lot when clinicians are writing, that usually the diagnosis leads and not the individual. But if you're writing for a journal focused on public health or societal health or social health or medical sociology, you should really use person-first language. And so an example of that would be, 20% of diabetic patients presented with XYZ. That's not person-first language. And so that journal can very quickly those reviewing that article can quickly just throw it away and say, you don't care about the person, even if you do. So it's just language choice and getting used to that journal's language, because very quickly that would be thrown out as opposed to using the phrase of, individuals who live in rural communities and have been diagnosed with diabetes. That's person-first language. I do a lot of mental health work. So if I review an article that says somebody died of suicide as opposed to, or committed suicide as opposed to death by suicide, that's usually a red flag for us. And I don't expect you to remember all of those little rules and tips, but if you have a journal you're writing to, read at least 5 articles from that journal. They don't have to be on the topic you're studying at all, but it'll help you learn the format of that journal and the language that's used. And it'll help you to make something that review panel is used to seeing and publishing. So language really matters, and you'd be surprised at how quickly you can be rejected just because you use the words dental health instead of oral health.
That is related to this next question. Do journals have biases in data sources? And might think about this from the rural point of view, but for example, would law enforcement data or interviews be acceptable along with clinical information for a community drug study?
Journals absolutely have biases against methodology and data sources, as do reviewers. And some of those are subjective. Some of those are going to be that I prefer one format of rural versus somebody else, or definition of rural. But at the same time, journals will be very upfront if they are publishing work that includes interviews or not. One thing I have done when publishing qualitative research, which is actually more of my area of expertise, is I will actually, the journal I'm about to publish in, I will search the journal for key phrases like interview results or survey results, and then just look at all of the things they've published using survey data or interview or focus group and see if they've actually done many. And if they've only published one in the last 3 years, my chances of getting published there are almost 0. So I wouldn't waste my time. And so, yeah, they do have biases. I don't think they're done ill will. So they might have biases just because their audience really leans more toward national data sets, or they lean more toward Medicaid data, if that's the case. But you can get very familiar with that early on. That said, though, what you're describing, and the question I see in the panelists, what you're describing is a little bit more of a mixed method approach. And that I think is perfectly fine. If you find an article, or if you're writing an article to a journal that's specifically quantitative in nature, and you're still doing quant, but you have an extra edge with some qualitative follow-up, I think that's perfectly fine. And if anything, it gives you an edge. But when writing your cover letter and describing your methods, really play up what that journal publishes, which is the quantitative data.
Excellent. Do journals accept single author research very often these days?
They will. I think it always looks stronger with a team, simply because at least 2 individuals would be needed, in my opinion, to have a good reviewed article. Even if it's just somebody who's helping you with the literature review and giving you a diverse perspective, or somebody who can read your results and then, or your data, and then see if your results actually match, your conclusions actually match the results of the data you're presenting. I think we all have so many biases ingrained that we don't even really realize we've got, that to have only one person reviewing data and drawing conclusions from that data and then making an implication or a call for action based off of that by themselves is a little frightening. I think it's always better to have at least two heads be a part of that team.
I'm going to start sharing my screen again. There was one more question. Davis, do you want to summarize that for Shawnda while I'm doing this?
Is it the self-plagiarism?
Yeah, the plagiarism.
Yes. No, I can speak to that one. I saw that one too. The question about self-plagiarism and whether or not it actually is a legal concern or more of an ethical concern or a journal rule. It does have actual legal repercussions. We have had one faculty member that had some issues with self-plagiarism. And what self-plagiarism is you've written an article, shared results, and then you've written those same results in another outlet. The reason that's a concern is because a lot of journals, when you've published with them, they have you sign a form that says they own those results. They own that data now. They own that information, and you cannot publish it anywhere else. That's why they are sort of that special source of information. But you can definitely take different perspectives and publish different results. So maybe you used a new complex model. Maybe you added a new variable you hadn't looked at before, and now that is a new study. The thing that I would always warn against, or a way to always caution yourself and save yourself, is to be upfront in your cover letter. For instance, we have a national data set using the National Resource Center on Native American Aging. 18,000 cases, tons of data, so much information. But every time we publish an article using that data, the methods section looks exactly the same. And so when we write that methods section, it's going to be self-plagiarism. No matter what, you can only write the sentence, this survey is done among tribes in the United States in so many different variations. So we're just very upfront to say, see other publications that describe the methods. And then we cite those publications so that we aren't doing self-plagiarism. We're citing the other pubs. And then we state that in our cover letter. We'll say we realize the methods are going to look very similar to the methods in these other 6 articles because it is the same survey. But survey A looked at diabetes among Native American elders. And this study is looking at cardiovascular disease. Completely different study, same data set. And so you just need to be careful. And the more upfront you are, the more protected you are from any issues of self-plagiarism.
Well, this was fantastic, Shawnda. I want to thank you very much for doing this today. We are interested in feedback regarding this webinar as well as our webinars in general. And if you look in the chat box, you'll see a link to the evaluation where you can scan this QR code. We do want to invite you all to participate in upcoming webinars. You saw that slide just prior to this. And if you have any questions regarding rural prep or this webinar in particular, feel free to contact any one of us, including just sending an email to rprep@uw.edu. So thank you again for your participation, and we hope you join us again.
Yes, thank you, everybody.
Thanks, Shawnda.